From agriculture to education, according to the WHO and UNICEF, the unprecedented and prolonged school closures aimed at keeping students safe from COVID-19 are harming them in other ways, urging governments in Africa to promote the safe reopening of schools while taking measures to limit the spread of the virus. A survey shows that of 39 countries in sub-Saharan Africa, schools are fully open in only 6 countries. They are closed in 14 countries and partially open for exam classes only in 19 others. Around a dozen countries are planning to resume classroom learning in September, which is the start of the academic year in some countries. We have joining us in our Lagos studio, Dr. Oluseun Olofi, a public health physician. Thank you so much for joining us on the program.
Thank you for having me.
So do you think that, would you expect the full reopening of schools in September?
Okay, schools, like we know, are not just places for academic instructions alone. They are also places where children have their social and emotional intelligence developed. And these students have been missing out on all this since the onset of the pandemic. So yes, with dropping numbers and daily infection rates, I think it's safe to say that schools should reopen in September, albeit with precautionary measures being put in place to ensure that things go smoothly. Are we looking at what the schools can do to ensure that these students resume safely? Are the schools willing to put in places things like the
face masks,
hand washing sites? Are they ready to provide PPEs, the face masks and face shields for their teachers and the students? Are they ready to carry out daily temperature checks? Are they ready to put all these in place? Things like downsizing classes might be needed.
That's a big difficulty, especially with the physical distancing.
Because it might require them to hire more teachers to manage these students. Are they ready to do all these things? Are things we should look at before we say schools can safely reopen?
Well, from what you've noticed, looking at the exams for exiting students, we've had some students who have gotten the virus. The government has still gone ahead with that. Do you think that we can apply all of that? And do you think that parents have also taken care with the non-precautionary measures for the students who have been writing their exams?
Okay, with the students writing their exams, we've seen them do things like keeping safe distances. We've seen them wear face masks, wash their hands, sanitize, and we've not really seen a skyrocketing increase in the COVID cases in the country. So yes, I think these measures are sufficient if they can be followed through. Breaching these protocols, breaching these safety precaution measures would only lead to a rise in the numbers. But so far, we've been doing well. And I think it's applaudable that these measures are put in place, and we hope that it can be sustained. Yes.
All right, so finally, the home front, what should parents start putting in place as much as the schools are preparing?
Okay, yes, we as parents and families have a role to play in this as well. We should learn to educate our kids on the disease. We should learn to let them know why they should take these precautionary measures. It's easier when they understand why they should do this. So we should let them understand why they should wear the masks, keep a safe distance. We should also provide them with hand sanitizers. We should provide them with the masks. And we as parents should actually do these things. Children learn when they see you do these things. They do what you do. So we as parents should do all these, and it will help and go a long way in keeping these kids safe.
It's a bit tricky, safe distance among children.
Yes.
Anyway, we'll see how that goes. Thank you so much, Dr. Oluseun Olofi, public health physician. Thank you for joining us on the program.
Thank you for having me.